And we're coming to our final speaker, which is Professor Jacqueline Dunkley-Bent OBE, our Chief Midwifery Officer for England. And Jacqueline's been in everywhere, I think, as a nurse, as a midwife. She's been a consultant midwife, a head of midwifery. She's been a director of midwifery and a professor, senior lecturer, curriculum lead, just about everything. And she's very much a midwifery leader, and she's really led the way and been very influential, certainly in England, also UK, I think, within the world, because I know there are some countries that have now got their own chief midwifery officers purely because they've seen what Jackie has achieved. So welcome, Jackie. Thank you so much for being with us this evening, because I know how busy you are.
Okay, so thank you so much. Really delighted to be here, and I'm just going to watch the clock because I know I've only got 5 minutes to speak. But just wanted to say, in terms of reflections, actually, just thinking back over the last year, in my family, my extended family, we've had 4 babies, 4 baby girls, and for every pregnancy, I have been called no less than probably 18, 19 times at various parts of the journey, and with fears, anxieties, some that I could answer easily, and others where they were really concerned, I am Black, am I going to die? So it was, you know, really, really tangible challenges that I've had to assist with. And then, of course, the pandemic. But moving from and all 4 baby girls are alive and well, and delighted, and my pocket will not be the same again at Christmas time. However, moving into the workspace, can I just say, just looking back over the last year, a huge, heartfelt thank you for everything that you have done, wherever you are in our amazing NHS, a clinical midwife, a support worker, student midwife, researcher, consultant midwife, midwifery lecturers, specialist midwives, strategy, policy, the amazing Sue Macdonald, wherever you are in this architecture, we have been working phenomenally hard for women, people, babies and their families. And I just want to say a huge thank you. It's been a really challenging 20 months, least of all in the last year. Like no other, I have never known this time in my entire career. And I just want to say thank you. I have been out with you on the front line, and I've also been the recipient of many concerns and challenges, and I just want to thank all for maternity, and particularly Sheena Byrom, for raising things to my attention. If we don't know, we can't act, but thank you for everything that you've done. We have seen, obviously, still in the global pandemic, sickness, death, fear. We've had to suspend some of our services to ensure that we keep everybody safe. We've had to suspend some of our national ambitions. And I know continuity of care continues to be a challenge, but because of your feedback, because we've listened, because people have come my way and shared, we have changed our guidance to ensure that at the very start of our continuity of care of guidance, based on what you've said, there are building blocks that are now in place that you have to achieve before further rollout. So you can't go any further with continuity of care until you have safe staffing, education of staff and engagement of staff. They're the building blocks, and we talk about that in the guidance. So please share with everybody. You can't get to the targets on page 10. You can't get to the other things on page 13 unless you have the building blocks in place. That's because we have listened to what you have said. We have had the Health Select Committee review, which Matthew Jolly, National Clinical Director, and I have had to give evidence on 3 occasions about safe maternity care. We have had the Afghanistan resettlement program. We have had the fuel crisis. Everything that's happened in this amazing society that we live in has impacted on maternity services. So thank you to those of you that have shared on Twitter at JDB, Woman Birthing Airside, do something. You know, these some of the challenges and items that have been raised, and quite rightly so too. But we need a little bit of a heads up before that time. But I just want to say, we have gone through quite a torrid time. We've lost some of our midwives, and their loss makes me stronger. I stand in solidarity with every single 24,500 midwives in our amazing country, standing side by side, wanting you. Sheena mentioned something about, she didn't say revisiting your first love, and I was trying to write it down as she spoke it, but there was something about just remembering repatriating yourself to where you were at the start of your journey. Let's just remember that when the going gets tough. We are in the middle of Omicron, or at the start of the Omicron variant. We've had challenges with the Delta variant. You've dealt with that phenomenally. We have lost pregnant mums because they haven't been vaccinated. And I could go on and on. But what I want to say, looking back, is a huge heartfelt thank you for everything that you have done. Please continue to share. I'm listening to those who are the Marching for Midwives. I'm listening to the Cheryl Samuels change.org petition, 118, 119, 120,000 signatures, lobbying government. I'm listening to the hashtag Say No to Bullying lead, and we will be pulling this together with the help of Byrom and Byrom next year to ensure that we move forward in a positive way for you, and more significantly for women and families that we serve. But looking forward, what I'd say for 2022 from me to you is, I want maternity services in England to be the safest place in the world to be pregnant, to birth, and transition into parenthood, and for that to be an equitable journey, regardless of the colour of your skin, the postcode where you live, or your socio-economic status. Everybody deserves that equal chance. And in 2022, for all of you, for every midwife and obstetrician and our support staff to feel valued, respected, and invested in. Now, that's a tall order, but I've got a lot of energy, along with the national team and the regional chief midwives, to make some of those things a reality. And together, because we can't do it alone, together we can achieve that ambition. All of us, wherever you are and whatever your role is, we can achieve that together. So they're my ambitions for 2022. I could go on, there's no time, but just thank you so much for listening. And again, a heartfelt thank you for everything that you have done and everything that what you will continue to do. What we do, and I'll repeat this, I say it all the time, what we do will ripple through generations. Your contribution is significant. Thank you.
Wow.